For those of you who don't know me, my name is Joe Kvedar. I'm the director of the Center for Connected Health. And this is my one time to stand in front of everyone and recognize the team. Today is day 2 of a conference. Those of you who weren't with us yesterday, we had a wonderful day, arguably a great success, really by all criteria, networking content. But I promise you that today promises to be at least as good, maybe even better. So it's going to be a fun day. And I have 2 things to do. I have a couple of actually tidbits and thoughts that I collected on the way in this morning. But first, I want to recognize the people who put this whole thing together. Now, this is a homegrown affair. We don't outsource any of this. It's done by staff at our center. And this time of year, that means everyone pitches in. It's sort of like a family doing a barn raising. And so that's one thing to note, is all the people you see out there collecting, doing badges and whatnot, that's our team. And I'm very proud of them for coming together, because they all have day jobs too. We don't just stop our activities during this time of year. The people, though, that really make it work year-round are 3 or 4 in number, and I want to recognize particularly Margaret Spinelli. Now, everyone knows Joe Trinello. Everyone knows Joe Trinello because that's the way he runs the event. But Margaret is sort of working in the background, executing, and since she's joined our team on this event, it's really gone up several notches, and we're so grateful to Margaret and her other team members, Lasad Friedi and Leah Del Rossi. So again, one round of applause for all the Symposium staff. Right, so I said I would share 2 tidbits, and then I'm going to introduce our first speaker. These are both sort of related to the area of technology and healthcare. The first, I'm going to thank my friend Ann Tuzinoff for pointing this out to me yesterday. Thomas Friedman, the New York Times columnist and renowned author, many of you, I'm sure, know of his book, The World is Flat, recently came out with a new book. Now, I read The World is Flat, and it didn't seem to me that long ago that it came out. But when asked about what's different between his books, I'm going to read you his quote because I thought it was fascinating. Facebook didn't exist. Twitter was a sound. The cloud was in the sky. 4G was a parking space. LinkedIn was a prison. Applications were what you sent to college, and Skype, for most people, was a typo. All of that in the last 6 years. So we really live in really unprecedented times when you think about it, the swirl of change around us and what technology is doing, particularly in the realm of connectivity. My second tidbit comes from just listening to the radio on the way in. I every morning listen to our local NPR station. This week they ran a series all week long on Alzheimer's, which has personal implications for me because my father was an Alzheimer's victim. And the story this morning was a connected health story, which I just thought was wonderful. It was a woman who, it was a story about a mother and a daughter, the mother having Alzheimer's, but the daughter having had the idea that, and if any of you have had experience with this illness, you'll know what I'm talking about, that people at a certain stage, they go in and out of lucidity, and when they're lucid, they can say very profound things, and then, of course, they back off. So this daughter had the brilliant idea, I thought, of tweeting those profound moments. And they share every day this woman's thoughts through Twitter with now 1,000 followers. So really interesting use of consumer-level connected health technology, I thought, and I thought I would just share that with you.